All right, so it's the holiday season. It's a little gray today. It's Christmas, almost Christmas. The end of Hanukkah. Today is the last day of Hanukkah. How have your preparations for the holiday seasons been? And how has business been considering it's the last quarter and the end of the year for your surgery center?
Well, holiday, I've never been more prepared than I am this year, which feels really, really great. So, no like running around like my hair's on fire. Have everything under the Christmas tree and all ready. And happy Hanukkah, by the way.
Thank you.
And Merry Christmas, Happy Holidays. Yeah, everybody's wonderful holidays. And as far as the surgery center goes, we are blessed with a ton of volume as we normally are in December, and it's been wonderful. It's been cranking up, and everybody's doing great to just take great care of patients and get through it.
Fantastic. Well, who you're listening to right now is someone with quite the pedigree in the surgery center industry. She is a former president of the Colorado ASC Association, along with being holding almost every other position within the board at least once. She has led our industry from a national perspective with ASCA, and has really helped them launch what I would say is the perception of what you see now from a national standpoint started off with Rebecca's leadership. And on top of that, she has sat on a number of different committees, whether they be associated with regulatory within the state of Colorado, but also acting as an advisor to ASCA on federal issues as well. So I think this interview and what we're about to talk about in this conversation is just a small piece of information that Rebecca Craig uh, holds within her head. And I would say that if you get the chance to meet Rebecca at an event, she is someone that really understands what walking the walk and talking the talk is. And if you're an individual looking to engage with your association or your industry outside of just your surgery center, she's an individual you should definitely spend time talking to. So, Rebecca, I really appreciate you spending some time with Casca today as we're venturing in on a new endeavor called Shorts with Schwartz, where we're going to talk about some subject matter interesting to the industry. And we'll get there eventually, but what I want to start with, because you do hold all of these in war, the medals that go on your uniform. What got you into healthcare?
Well, first of all, thank you, Simon, for the wonderful little bio and kind words. I super appreciate that. It's been a pleasure to work with you and the Casca team for years now. Um, what got me into healthcare? Come from a family of registered nurses. My grandma was a nurse. My Aunt Mary was a nurse, and I wanted to be a nurse. That's all I knew. I wanted to help take care of people. And I quickly got into the surgery realm, thankfully, to a wonderful neighbor that my parents had that allowed me to shadow her in outpatient surgery. And that just planted the seeds, and that's all I wanted to do. And ended up in the surgical environment, perioperative services, and then gosh, I think 2000 ended up in strictly the outpatient world. And ever since then, yeah, ambulatory surgery has been my passion and just very honored to be in this wonderful industry.
What part would you say within the surgery center business, and I'll put out there for full clarity. I have also been involved in the industry since the early 2000s, so I've been lucky to be alongside Rebecca this whole way. But within the surgery center business, you said that there was something that just grabbed a hold of you that you were attracted to. What do you think that part of outpatient surgery was? Because at that point to what it is now, it's a different industry. But I still think that there are some core characteristics of it, which maintain whether it was 20 years ago or 3 days ago. So, what specific areas um, made you passionate about outpatient surgery?
I loved the fact that it was solely focused, I felt, on the patient, all of our customers. So basically, our patients, our doctors, and our employees. I thought that the focus was just as a well-oiled machine, and we could serve our patients better and our physicians better. I loved the fact that it was cost effective and everybody's focus was just trying to take great care of patients and have an effective product for people, so that, again, healthcare being affordable has been and will continue to be such a hot topic, but it was just the perfect combination to me.
Patient care is definitely a focus, and we talk about how industries evolve and how industries change. And I think one of the biggest differences now between 20 years ago was the physician's presence within the model. In that right now, while physicians have ownership, it's not the same as it was 20 years ago. But I think to the comment that you're making that I'd love to hear more about is the attention to patients and patient satisfaction. You've been an advocate on the surveying of patients and utilizing that data to not only improve the services that are coming out of the ASC, but utilizing that data also to effectively advocate for ASCs in DC and in Denver at the Colorado Capitol. And what I would say also in line with that, being a national leader, you have also encouraged others in other states to utilize those tactics. So, would you mind talking a little bit about how patient satisfaction plays a role, and a little bit more about the surveys and the importance behind the surveys?
Certainly. So, gosh, patient satisfaction has always been key to many entities, but for ASCs, I think that that was one of our hallmarks, because patients would come to the surgery center and they would rave about the personalized attention that they received. They'd rave about how we were on time, we got them in and out and back to their houses to recover quickly. So I think patient satisfaction has always been forefront in our mind. I love looking and picking apart patient satisfaction surveys, just looking for improvement opportunities to say, is there anything that we could have done better for this patient? What are we excelling at? And so I know that when we meet with legislators and people, we always let them know that wonderful patient satisfaction is a hallmark of our ASC industry. I love to tout that. And I know that in other healthcare settings, that isn't always the case. So I'm very proud of the product that we have here for patients and for our physicians and for our team members. But I think when it comes to patient satisfaction, it on a national level, we have been lobbying for that because we needed something to show the apples to apples from the hospital setting to our setting. And we never had those that apple to apple scenario. So nationally, it's exciting for us to have the opportunity finally to have the OAS CAHPS survey that will we're participating in it now, but we in 2025 it will be mandatory for ASCs to participate. So I'm hoping, and the reason for this lovely little get together and podcast is that hoping that every facility is already participating in it so that they can be prepared and already have worked on the areas of improvement, so they'll come out shining. And I had chatted with Kara Newberry, ASCA's Kara Newberry, a little bit about the OSCAP survey to say, okay, in 2025, are we going to have a certain satisfaction rate, or are we going to be penalized? And she gave me good peace of mind to say that no, the requirement for starting in 2025 was that we had to complete 200 surveys. So from the Medicare patients that we take care of, we'll have to have 200 of those, or 200 surveys basically submitted. We have struggled because when Medicare first came out with the proposal, they talked about having just a telephone or a paper survey method, which we just were shocked over. So I know ASCA has done a fantastic job to work with CMS and to say we need an electronic only method.
It seems like CMS might have been thinking it was
I'm
1985
not
for
sure
surgery
what they were
centers.
thinking, but I think everybody was kind of shocked and awed when we looked at that to say paper and telephone calls. Nobody even wants to answer their phone anymore. It's either text messages or, emails.
Let alone we're getting into an election season, which means even more folks aren't going to be
Avoiding,
answering their phone and
exactly.
avoiding the
Avoiding the phone
communications.
call. Yeah, that's exactly right. So we were a little bit worried about that, but again, ASCA has lobbied, and I think we're starting to make good headway to hopefully having that electronic only option. But the other part of it is it's quite lengthy, so there's quite a few questions. So I think, again, one more, it leads that we need to have an electronic tool. Nobody's going to stay on the phone with you for an hour while you go through, X amount of questions. So all these factors adding up. And again, I know that the deadline got pushed, so now it's 2025 when we need to participate in this. So I hope folks are working with their vendors. We use Press Ganey for ours, but there's quite a few approved CMS vendors that people can go through. But start working on that and working towards getting those things. Like I know, with the first time we did our participated in the OAS CAHPS survey, we got information back, and our discharge instructions and our teaching, that was our lowest rated survey, and or section of our survey. And that we went immediately to, okay, what are we missing here? How can we better educate patients before they leave our facility, so that they feel confident to, rate us really high on this, and that they feel confident to take care of their loved ones at home, and they have all the information that they need.
How does your team react? I think of this in a way like a job review, your annual, and it's more than annually, right? Because patient satisfaction is every day.
Continuously, yeah,
It's it,
exactly,
it's
every
it's
day.
continuous, exactly. How is the transition? Because obviously it's been postponed till 2025, and who knows how much further it could be
Yeah,
postponed, right? We're
yeah, we
healthcare
don't know. Yeah,
and government.
exactly.
It's how it works.
Exactly.
But the reality is, and I hear what you're saying, and not so in a more direct way. Get on it now, because it's better to be prepared earlier than be sprinting later to figure it out.
That's exactly right.
Um, my question is similar to a review, and I think healthy workspaces, staff people look at reviews as a way to grow. But there's the other side of it, where some people might get reviews and get incredibly defensive, and it makes the workplace not necessarily as good as it was. Now, obviously, that's a staff issue, but how do you think the staff react and consume the data that comes back? Obviously, you and a couple others are going to be the mouthpiece providing the outcomes of this data. But how do you see it impacting the staff of the surgery center when you're able to pinpoint some specific areas that could use improvement?
I think the staff is fairly open. Every once in a while, somebody does get defensive about something, and we really try to work hard that we're just focusing on the process. There's nothing punitive about it. Hey, we just want to sit down and we want to work on this improvement opportunity, so that we can have the patients have the best experience possible. I think the physicians sometimes get feedback. So when you speak of defensiveness, sometimes we we do, and I think that's maybe our normal reaction is when somebody has a critique of us, we do get a little bit defensive, but we just talk to people. When I say people, I mean team members, physicians are a part of that, about just trying to be accountable and to say, hey, what can I do better? If somebody has the best practices, because they may have a partner that has a little bit of a different process or a different take on something, and I say, well, Dr. So and so scores are coming in very high, let's look at maybe their process. So it takes a little bit of finessing and conversation to get through, but I think it's all just about being accountable and how we can be our best.
And I would just say to follow that up, I think change is one of the most difficult things to implement in it, and it's because you're creating a little bit different of a culture change, right? um uh, to hear that the process is one where everyone is malleable and flexible for the most part is a positive one. So I would just follow up in saying that the more our facilities participate in providing data like this, it only benefits us. Would you mind chatting a little bit about the bottom line? Because obviously, you bring in another service, you're paying somebody else to collect this data for you. It's another expense. We're dealing always with expenses related to regulatory issues and new vendors, new prices, all these different things. So what do you think is the biggest value behind what's the ROI? What's the return on investment with engagement with a company like you use, or just what's the ROI related to the data that you're getting?
Yeah, well, I love that point, because as a small business, we are all constantly looking at how much this is going to cost us, how much manpower is this going to take, you know again, how much is the vendor gonna charge us? So I think that that's a really good point, which is again why we don't want it to be telephone or paper, because it's going to be extremely cost and time intensive. I think that, oh, gosh, I think that the biggest value to us, again, we're trying to, it's that balance of how much the vendors are going to cost us, but the value is we want to be the best. So if it's gonna, and we're gonna have that apples to apples data, which for me, and I know many other of my colleagues, to have that when we're talking to our representatives and senators in DC, or in Denver, I just would love to say, here's how we compare to our competitor, and whether that's the hospital, whether that's another surgery center, it's going to be wonderful to have that information, and information is power, data is power. So I think there is going to be a cost to it. We're going to try to make it as most efficient as possible. Again, electronic, honing in on all those questions and working on all that. But I think it's going to be good for our business. It's going to be good for the ASC industry to be able to tout what our percentage, our high patient satisfaction scores are and how we compare.
No doubt. I'm in agreement. I'm lucky to be an individual that gets to go to Washington, D.C. each year with ASCA and lobby our congressmen. We are at the Capitol regularly, talking with legislators and doing tours. And I think one of the elements where we haven't engaged as much, but I do think CASPA will, is city councils. And I think that our ability as an organization that represent outpatient surgery centers is to make sure that all levels of government understand who we are and what we're doing, because at the end of the day, we have to thank Rebecca and also my father Rob Schwartz at the
Definitely.
beginning of Casca, where our tagline is "Our patients come first."
Yep.
And to not to wrap this up completely, because I want to offer Rebecca a little bit more time to answer any, or to provide any context or answers related to patient satisfaction. But the reality is, our patients come first. Our physicians, this industry began because we patients were having difficulty getting access and spending more money than necessary because of the large the system
The system.
behind
Yep.
it.
That's a good way to put it.
And I think while the industry has changed, that hyper focus on patient satisfaction, the hyper focus on taking cases out of a setting that don't need to be there and putting them in a setting that is built for them is still the core characteristics of what this industry stands on. So I'd love to give you a couple minutes to cover anything else you'd like to chat about related to the patient satisfaction surveys. And then I have one last question to wrap this up with.
Hmm. Well, I appreciate you talking about how when Rob was creating the Casca mission, basically, because when he had the board sitting around and we kept saying, our patients, that we're doing this for our patients. It's always about the patients. And so when he said, our patients come first, it was so simple, but so perfect as far as our mission, because that's why we're here day in and day out and working so hard and like you said, trying to educate people, because it's insane that in 2023 we're still having to let people know what a surgery center is. I think more people do know, but we still are having to do a lot of legwork and let people know what the great services that we can provide here. And I just think we just need to continue to shout at the top of the rooftops at how great we're doing. And this survey data will give us the information I think that is definitely needed. So we will have that apples to apples information and comparative patient satisfaction surveys, and then just continue on what we're doing, what we do best, and that's serving our patients and serving our physicians that we work hand in hand with, and just continue to serve our communities.
And I'd like to follow that up with economic impact. Surgery centers are small businesses within communities. We are staffing at all different levels. Rebecca, you mentioned physicians and nurses, but let's break it down to janitorial staff.
Mhm.
Let's break it down to construction
To our
and
wonderful receptionists who
reception.
greet our
Uh,
patients all day. Yeah.
so we are full universes within communities, and I really appreciate the time. My last question, and it doesn't have anything to do with healthcare. What are you most looking forward to in 2024, and what are you least looking forward to in 2024?
That's totally a loaded question.
Yes.
um, oh, good heavens. I'm looking in 2024. I think my focus for 23, and I'm going to continue and roll that into 2024, is like health and well-being because we give so much to other people. Sometimes we don't focus on ourselves to stop and say, "Hey, I need to stay healthy." And so I think I'm going to continue that 2024. So I'm looking forward to working on my health, my family's health, and ensuring that I can continue to do this position for years to come.
Amazing.
So healthy wise and least looking forward to probably the election
So it's
because
funny.
because of just overwhelming the polarization that people are feeling, and it affects our homes, it affects our work.
Can I tell you how someone described it? They're looking forward to the policy of 2024, but not the politics
Oh, I
of
love it.
2024.
There you go.
And that is quoted from our lobbyist, Lisa Ward.
Wonderful. I
Uh,
think that's right on. So yeah, I think I couldn't have said it any better than that. So
Amazing. Well, Rebecca, I really appreciate your time today. We are in a gray day, but a lovely day at Harmony Surgery Center here in Fort Collins. And again, I can't encourage you enough if you're at a Casca conference, if you happen to be at ASCA Orlando this year, if you're at a DC fly-in and Rebecca's there, she is a wealth of
I'd
resources.
love to
So
connect.
so chat with her, and I'm just going to do a plug for our organization in the sense of we represent you, but you represent yourselves the best. We have opportunities for leadership. So I highly encourage you to get engaged with Casca. We're definitely the first step if you're interested in national involvement. So reach out to Chris, myself, or Mallory, or any of our leadership like Rebecca, Lisa, David Ornelas, Barb Hardays. I'm missing other names there, but we are all here to chat you up about how to get involved with our industry. So again, thank you so much, and
Thanks.
have a very Merry Christmas, a happy holiday season, and look forward to seeing you soon.
Thank you so much, Simon.
All right,
Appreciate it.
thank you.
Thanks.
All right, well, that was it.
Excellent.